rheumatologist working at the lupus unit at King's College Hospital in London. His research interests include investigating why some patients don't respond to certain lupus treatments, and neuropsychiatric and mental health symptoms in SLE, and he's also done a lot of work in lupus fatigue in the past. So he's here to talk about neuropsychiatric and mental health symptoms in lupus.
Okay, thank you. It's really nice to be here in Cardiff. I've been here twice before. Once was to see a concert when I was 17, and once was to see Norwich City lose the playoff final 21 years ago yesterday. So I've had mixed times while I've been in Cardiff. It's lovely to be back here for a third time. So thank you very much to Paul. On the day of Eurovision, I see I've got this microphone. I'll make sure there's no pyrotechnics or anything too extreme that goes on. And I've been given the challenge to talk about neuropsychiatric and mental health symptoms in lupus. So this is a big, big subject. I will cover as much as I possibly can. And this, when I've given these kind of talks before to patients and doctors and researchers, there's often a lot of questions. So I'll be hanging around. If you've got questions, then do let me know. So first, some things about me. I am a rheumatologist, as Paul said. I have never worked in neurology or psychiatry. So I work with some psychiatrists and I use some of the phrases that I think that they use, and I often get it wrong and they correct me and I learn. So I am a rheumatologist. Neuropsychiatric lupus is really poorly understood, so I feel like an absolute fraud standing here in front of you, having come all the way from London to talk about neuropsychiatric lupus, when I stand up here and say people really don't know much about this at all, but I want to be honest that it's one of the areas that's really poorly understood. Many of us as lupus doctors or rheumatologists have not been trained in how to look after mental health. And I often find myself sat in clinic and I'll say, "Oh, how are you feeling?" And if someone says, "I'm feeling fine," then I go, "Okay, great, I can just get on with it." If someone says, "You know, I'm struggling a bit," then suddenly as a rheumatologist, I don't often know where to turn. And I'm learning a bit about this the more I ask those questions, and from some of the things that I'll show you today. But I will come on to the importance of talking about those symptoms. So I gave this talk recently to a group of psychiatrists, and I said in terms of neuropsychiatric lupus and mental health, we are probably down here, so there are some green shoots growing, but we definitely don't have all the information, but hopefully we will move along that side towards, a full understanding soon. So the things I'll cover today: what is neuropsychiatric lupus? How do we define it? How do we look for it as doctors? What do we miss when we're looking for it as doctors? How can patients and doctors work together to help find some of these symptoms? And what do we know? And also, what do we not know? So I thought I'd start, as I'm first up here, with some brain facts in the form of a quiz. So every time your heart beats, have a think about this: how much of the blood that leaves your heart goes to your brain? So A, 5%, B, 10%, or C, 25%. I don't know how interactive the audience will be today, so you can be thinking of that yourself, or if you're really confident, you can stick your hand up. So as I'm not seeing anyone jumping up straight away, it's 25%. So, considering that, you've got your whole body, quarters going that way towards your brain, so it's a very important organ. It's very active, it needs a lot of nutrients from the blood. The size of your brain reduces as you get older. Yes or no? So I hear some people mumbling yes. Yes, that is correct. So it doesn't drastically shrink, but we do see that as people get older, the brain does look different on scans, even in normal health. What generates more energy, measured by watts? A light bulb, your brain when it's resting, or both are the same? So it's C. So I thought that was quite interesting, that actually, you could power a light bulb with what you're doing just when you're sat watching the TV. This isn't even when you're thinking hard. So, it shows how much energy your brain is using even when you don't realise it. The other important part of the nervous system is actually the nerves. So here's some nerve facts, again in the form of a quiz. When the baby is growing in the womb, how many nerves is it growing each minute? Is it A, 250, B, 2,500, or C, 250,000? So that's each minute. And again, it's lots. So this is to show, you've got lots of nerves. Babies growing nerves all the time. It's a big, big system. Damaged nerves can be repair and replace themselves? Yes or no? So it's kind of no. So they can repair themselves a little bit, but they can't really replace themselves. And the importance of this is that when a nerve gets damaged, it takes a long time to repair, and it may not repair quite as well as it was before, which is really important to think about when we think about how lupus might affect the nervous system. How many neurons or nerve cells are in the brain? 10 million, 1 billion, or 100 billion? You can see it's the exaggerated one every time. It's 100 billion. So this is just to show there's lots and lots of nerves in your brain. Okay, so it's a really complicated big system, and perhaps I'm telling you this so that I can say it's really, really complicated, and if I can't answer your questions later, it's because it's this complicated, okay? But what I will do is try and tell you from a lupus perspective what we do know. So why does this all matter? Well, the brain is really complicated. It's got billions of nerves in it. Nerves are not good at repairing themselves when they're damaged, so it's important to think about in health and illness. When damage is done, hard to fix, and healing and repair of these nerves and the nervous system can take a long time. And I think this is really important when I see patients who have got lupus that has affected the brain or nerves, that people are often wanting to get better quickly, but just because it takes a long time for nerves to recover, it can take time, and that in itself can be very frustrating. There are loads of these nerves, so there's lots of things that can potentially go wrong, and that's why symptoms of the neuropsychiatric lupus variety are often quite variable, because nerves are pretty much everywhere, and there's still a lot we don't know. So, neuropsychiatric lupus, what is it? Well, this is the term we use for when lupus affects the brain, the spinal cord, and the nerves, so it's super broad. I googled it last night just to double check, but super broad. Symptoms may be neurological, so that means that they're coming from damage to nerves. So is that pins and needles and tingling, things like having a stroke, and then there's these psychiatric side of symptoms, which give mental health symptoms. So rather than pins and needles, or something you feel physically, these can be changes in mood, emotion, and things like that. And you can see we're already getting into this difficult spot of how do you define what those symptoms are, how do you know that they're due to lupus, and that's something I'll try and cover here. So it's hard for doctors to agree, actually, on what is due to lupus. So, for example, lots of patients will say to me that their mood is very low, and it's hard for me to tell, is that due to the lupus being active and the inflammation affecting their brain, or is it because they've got a long-term health problem, and that in itself poses a number of difficulties. We know fatigue is a major issue, and this will affect the way that people live their daily life. So do we need to give immunosuppressive medicine, or is there something else we should be doing? There is no one good single test. I've spoken to quite a lot of people about this informally. Lots of people have MRI scans, they're generally quite normal. CT scans, also quite normal. Blood tests, they can also be normal when you've got problems. So it's really hard, and as a doctor, you like to see that something's wrong, so that you can then go, there's that thing that I need to treat, and then fix it. You don't really have that with lupus when it affects the brain or nervous system. The symptoms are really very diverse. So one patient may say, I've got pins and needles, another may say tingling, another may say weakness, and we don't really know what that's describing and what that is for that individual person. And as doctors, we're much better when we have, for example, a kidney biopsy that shows there's a problem in the kidney than actually understanding what these symptoms mean. So it can be very difficult for us to understand. And it can occur when the lupus is otherwise quiet. So again, this is the one that really is very tricky for me in terms of trying to treat someone when they've got neurological symptoms, but otherwise nothing else needs treatment. Because you don't want to give someone the treatment that's going to make them feel sicker unless you definitely know that that treatment is going to make the symptom better. So it's all about risk and benefit, and that's the situation that's very difficult. These are what the technical terms, if you look them up in the textbooks, are for neuropsychiatric lupus. Now, a lot of this is jargon, and I also think this is jargon. So this is neuropsychiatric lupus when it affects the central nervous system, i.e. the brain or the spinal cord. So people can have symptoms like meningitis, stroke, but then headache, seizures, cognitive problems, psychosis, being acutely confused. All of those things are very, very different, but they all get clumped under neuropsychiatric lupus. But why would anyone compare a headache with seizures? They're both very separate things. But when we're looking at it in lupus studies, they're all kind of clumped together. So this is not great, and this is what we base a lot of our research on. It can also affect the peripheral nerves, so this is anything away from your spinal cord, and the ones that are kind of highlighted here are just problems with the nerves that may cause weakness or tingling and numbness and things like that. But all of these get clumped together under the term neuropsychiatric lupus. And as you can see, you can't really compare someone who's having a headache with someone who's having seizures with someone who's got a nerve problem. But this is the way that things are unfortunately stuck together from a research perspective. So it ain't perfect, and I'm very, very keen to put my hands up to say that we need to do a bit better than this. So what can cause these symptoms in people with lupus? So identifying what's triggering these symptoms is very, very difficult as a doctor, and I always find this really challenging in clinic. Most rheumatologists are pretty poorly equipped to deal with some of these symptoms. And like I said, if you speak to someone about their mood, and that person says their mood is a problem, most of us are not trained in what to do next. And some doctors I know will deliberately not ask that question because they fear not being able to do something when it gets raised, which I understand. I totally understand that, but it doesn't help with the problem. So when I'm seeing someone with lupus who does describe either neurological or psychiatric symptoms, I'm asking myself, is this related to the lupus, the inflammation caused by lupus affecting the brain and the nerves, i.e. I need to give stronger treatment to suppress the immune system? Is this damage from previous lupus? Was there lupus in the nerve 20 years ago, and because we know that the nerve takes a long time to heal, that symptom will just persist, and giving stronger treatment will not get that any better? Is it due to the treatment? We know that some of the treatment can be quite toxic and have side effects. Is it the treatment that's actually causing the symptom? Is it due to another concurrent psychiatric diagnosis? So for example, does someone just happen to have developed schizophrenia and also have lupus? It's not impossible, and therefore giving lots of immunosuppressive treatment to that person isn't going to make them feel any better. If anything, it's putting them at risks of side effects. And is that due to lupus, or just entirely by chance? So this isn't, again, perfect, but this is how we try and work out whether we need to give some treatment for these symptoms. And essentially, I say it's very, very hard to tell. Now, this is where I've tried to kind of learn. I've seen lots of people with lupus, and maybe we're not asking questions well enough, maybe we're asking the wrong questions, maybe we're defining things all wrong. But I wanted to look at all of the studies that say how common are these things. So the studies, actually, if you look on the internet, are really not good. There's a wide range saying that these can be very frequent or very infrequent. Lots of lupus doctors don't really actually have any agreement at all between whether a symptom is related to lupus or is not. And a lot of these symptoms are often missed in the studies. So again, it's not a great way of capturing this information. In terms of the clinical picture, i.e. the studies looking at patients, again, it's very, very variable. And it says here the prevalence is between 12 and 95%. So that means only 5 people out of 100 do not have neuropsychiatric symptoms, or only 1 in 10 has these symptoms. So the studies are really not great. I mean, there is no point saying that it's between 1 in 10 and 10 out of 10. So these studies are not good, which means that we can't really learn from them. These are just some of the breakdown of those symptoms, again with the prevalence. And I've just highlighted a few of these. So this is in lupus. So first of all, the suggestion is 0.6 to 11% of people with lupus have psychosis. But that's, again, crazy. You're talking about not even 1 in 100 people to 1 in 10. So again, it's really variable, and you can't really use that at all when seeing people with lupus. Being confused, again, roughly similar. Cognitive impairment, so it's either 8 out of 10 or 6 in 100. It's really not helpful, this kind of study. And it depends how you ask the questions. If you say, are you confused? Have you ever felt confused? I think, when I was trying to get to Paddington Station this morning, I'd say I'm confused. So I think it's really not helpful to tell us in terms of lupus whether these are genuine symptoms. So what I'd like to do is talk a little bit about some research we're doing with Mel Sloan, who is actually really interested in trying to ask these questions in a different way. And we've been working very closely with Paul and people at Lupus UK with regards to this. And we're starting to get some results we hope will tell us a bit more. And actually, I'm on the study team. When I saw these results, entirely changed the way I speak to people, because I did not expect these results, so I want to share them with you today. You might say, what I'm about to show you is completely obvious, but all of this was quite surprising to me. So we did some research. We wanted to understand how common these symptoms are in patients with lupus and what we call SARDs, so any other autoimmune rheumatological diagnosis. We didn't restrict it to those silly classification criteria, so we just kind of left it fairly open. And we also asked healthy people, which I think was friends of people completing the survey with lupus and other autoimmune conditions, to fill it in. As you can see, we had thousands of people respond, and we can start to tell some answers. We also asked doctors what they think the prevalence of these symptoms are. So on this graph, in kind of the purple colour is rheumatologists, and they were asked, people with lupus, what percentage have hallucinations, what percentage have mania, what percentage have weakness, what percentage have fatigue. In the red, we also asked neurologists, and in the blue, we asked psychiatrists. And what we can see here is that the psychiatrists were guessing a lot higher than the rheumatologists and neurologists. But what did the patients say? The green line here shows you that hallucinations were much higher than any of us guessed, as were symptoms of mania, feeling suicidal, and having obsessive thoughts. So although the psychiatrists were much better at predicting this than us rheumatologists, we were all still way off. This then continued for what we call negative sensory symptoms, which is nerve symptoms, poor coordination, positive sensory symptoms, weakness, and the only one we got close to was fatigue. So this was really quite shocking from my behalf, because I think if you look at that first line with hallucinations, what you're seeing is perhaps rheumatologists think maybe 5% of people with lupus have hallucinations, and nearly 25% of patients reported hallucinations, which means that 20% are not being spotted by rheumatologists. So I started asking these questions when I see people in clinic, and I was amazed to actually see some of these results come through when I actually spoke to people, purely because I never asked anyone, that frequently, are you having hallucinations? And I was surprised by the number of people who said yes. So again, we've got these classification criteria, and maybe actually asking patients about the symptoms is much better than all of this research. This here, again, is just comparing the rates of these symptoms compared with healthy. So healthy people completed the survey, and their response is blue. People with autoimmune rheumatic diseases like lupus, they're in green. And just what we can show you here is seizures, just a little bit more. Tremors, much, much higher if you've got an autoimmune condition. These sensory symptoms, again, much higher. And cognitive dysfunction, so confusion, difficulty processing, difficulty thinking and concentrating, again, much, much worse if you've got something like lupus, reported much more commonly. And the highest rates, although this was in a lot of autoimmune conditions, were seen in lupus. And we're probably underestimating these symptoms. And as a result, if we ain't guessing that these symptoms are around enough, we aren't investigating best to sort them out, because we kind of don't see them. We're a bit blind to it. This was the one that also concerned me, that actually patients were reporting feeling suicidal a lot more prevalent. And again, we are not well prepared in many lupus clinics to ask that question, and I think a lot of doctors often fear asking that question. If someone turns around and says, yes, I do feel like that, they will panic. The doctor won't know what to do. And I've had many conversations with patients where they've also not wanted to volunteer that their mood is low, because they're worried that as a doctor you will start them on a load of medicine, or you'll send them to a psychiatrist. I've had patients who've told me they're worried that they're going to end up being admitted to a mental hospital and things like this, because they are scared of talking about these symptoms, which I think is where we have this problem. We have doctors not knowing these symptoms are there, and we have patients nervous to talk about them, and as a result, we're not appreciating them and dealing with them. This is just a little bit more, showing that depression, again, was much more common in our patients who completed the survey with lupus than healthy, but also than the other autoimmune rheumatological conditions we look after. And in particular, those patients reported more severe depression than other groups. We saw a similar picture for anxiety. Again, patients with lupus reported much higher levels of anxiety, and that anxiety was tended to be more severe than other autoimmune conditions. So what we're actually seeing from this is that things are common and things are severe, and that doctors are not good at picking this up at the moment. We've also done a smaller study to look at people's quality of life and how they function on a daily basis. So this is nothing to do with how you feel, but more how you get on with your day. How do you get to the shops? How do you can work and things like this? And all of the things we found in bold here were things that were associated with people functioning worse on a daily basis, i.e. being able to do less. And things fairly common there, like having lung disease, being older, being fatigued, and having pain, all impacted on people's ability to function on a daily basis. But so did anxiety. So although we're looking at how people physically function on a day-to-day basis, In this study, we found that anxiety was a major contributor to that as well. So it's common and it impacts. So having told you all of that very, very sad and difficult news, how can we do better? Well, we have to accept there's no perfect test. So there's no point us doing loads of tests, saying they're negative, and then ignoring it. But what we can do is some blood tests. A lumbar puncture is sometimes useful, so taking fluid off the spine. Scans of the brain, either through an MRI or a CT scan. We have EEGs, which we sometimes use, which measure brain waves, and nerve conduction studies, which measure the way the nerves impulse, for example, in the arms or legs. And then what we call neurocognitive testing, which not many places do, and we're trying to do a bit more now, which is a way of just looking at the way that people process their thoughts, something that you can't tell just by examining someone or doing a scan. So these are all things that we might consider if we're worried about neuropsychiatric lupus. But like I said, we know that these are not perfect. So in summary, these symptoms can be really broad, and if anything, they confuse doctors. So I think this is where one of the problems arises. Some of these symptoms are not obvious, and doctors will miss them. And I have missed them, because I have seen patients in clinic, and when I saw these results, I asked people, are you seeing things? And they said, yeah. Say, how often have you been seeing things? How long has it been going on for? And they say months. Months and months. And they've been seen multiple times in hospital, and we ain't picked it up. And again, it's because we haven't asked, but also people are nervous about saying, yeah, I have got this symptom and it's quite nasty. I've had people say, I'm seeing a shadow every day, I try to ignore it, I know it's there, I know it's not real. People say, I think there's a cat in my house, all kinds of things. But people are worried to talk about them because they're worried that that will cause people to think of them in a different way. It's difficult to tell if these symptoms are due to active lupus or something else, and as a doctor this is the one that really worries us because we want to treat it if we think it's due to lupus. We don't want to treat someone where it's due to something else, and this is the one that makes it difficult. Symptoms of poor mental health are common in lupus, and we know that they really significantly impact on daily life, which is disappointing as a doctor because we think that we make people better by making the joints better, switching off kidney disease, making rashes go away. But if there's still something that's impacting on quality of life, we need to be better at dealing with that, picking it up, and helping to treat it. And there are sadly barriers to identifying these symptoms on our side. So, in conclusion, we don't really understand this. I've just scratched the surface here, but I've learned a lot more through doing this research project than at any other point through all of my training. The symptoms can be really subtle, so as doctors we have to really look hard for them. We don't identify them very well. People are often quite fearful of the stigma associated with talking about mental health with doctors in particular, and I've had a lot of patients say that they're worried about being judged. It can be difficult to investigate when we do hear about these symptoms, and we need a good team because, as I mentioned at the start, I am not used to dealing with asking about mental health or what to do when someone says they need help, so we do need to work well as a team. So, rather than leaving on that slightly sad note, I want to say where we should go in the future, how we can make this better, how we can improve. So as doctors and nurses, we need to increase awareness. So I'm giving these talks to my colleagues, but I'm also really glad to be here today to talk about this with you guys. We need to see the impact of these symptoms on people. We can't just ignore it and just say, oh, it's one of those things. We have to inquire about these symptoms. We ask you, how are your joints, how are your skin? You've got mouth ulcers, is there any rashes? If you have any chest pain, we're perhaps not quite as good at asking about how are you feeling, how's your mood, are you seeing things, have you got problems with your nerves? We then need to be able to measure them properly, rather than just saying, you're feeling all right, and then your response is yes. Yes, not measuring at all. You can't tell one visit to the next, so we need to get better at measuring it, and we need to find some better tests. And as doctors, we need to listen when someone is telling us they've got these symptoms, because sometimes I think they do get a bit washed over with everything else. From a patient's perspective, and I say this with a bit of nervousness, but I say talk about these symptoms, and the reason I say a bit of nervousness is I hope that if you talk about these symptoms, you will be listened to. I'm trying my best to listen when I hear them. I can't speak for every rheumatologist in the country, and I really do hope you get listened to, but I think it's important that you do talk about these symptoms if they are impacting you. Ask for help, whether it's from your rheumatologist, your GP, your nurse, your friends, but it's important to talk about it and explain what your concerns are with these symptoms. Seek support, and actually Lupus UK have a huge amount of support. Health Unlocked Forum, you know, I've heard a lot of people say being on the forum is really supportive to have that peer support. And the REN project is a group that I've only recently become aware of for patients with autoimmune disease, having mentorship for each other. And I think certainly, you know, I can do my best, but I think sometimes having a peer who knows what you're going through and can, you know, perhaps is a bit further through this and has experienced this to tell you how they dealt with it can also be super helpful. So the future. As I mentioned, we're down at this little part here, but how are we going to get better? Well, I think that we need to recognise and identify these symptoms, and that's us as doctors being aware and also patients being comfortable and confident to talk about them. We need better ways of testing for it. We need dedicated studies to find out what treatment actually help with these symptoms, and we need a better way of clarifying and quantifying these symptoms. And we can only work that out as a team of doctors. I will not be able to do this on my own. And with that, I'd like to conclude, and I'd like to say thank you to a few people. So these are my colleagues at King's. We have actually realised since doing this research that we have had so many people telling us they've got these symptoms that I do not know what to do. I am having patients saying they are hallucinating, that they have strange symptoms, that their mood is all over the place. And as a rheumatologist, I'm very good at saying have some steroids, but beyond that, I am in difficulty. So I am very lucky to be meeting with these fantastic colleagues from psychiatry and neurology. We meet once a month. We met yesterday, and we discuss any patients that we're worried about. And that's really helpful for me. I feel a lot more confident asking patients about these symptoms, knowing that I can turn to my friends here and say, someone's told me this, what do I do? What treatment can I give? How do I investigate this? When it's not steroids is the answer. So I think as doctors, we need to work well as a team. And I'd like to say thank you to Lupus UK. I'm still doing research in the field of lupus, thanks to Lupus UK sponsoring my first ever year of research, and it's all gone from there. So this is all huge thanks to Lupus UK. So I'm very happy to come to Cardiff and to speak to you all. Always very, very happy to be invited by Lupus UK. Manly Sloan and David De Cruz are both helping with this project, as are a whole group of people under the, what we call the Inspire and Adapt research teams. Some of whom are in this room here who really challenge me and point me in the right direction and make me think about this very, very differently. Thank you to all the patients. You know, to have over 500 patients completing our research questionnaire, we know it takes time. We know loads of people are asking you to do things, so we really appreciate patients taking the time to honestly tell us about the symptoms for our research. And there was meant to be a nice little picture up here, but it's disappeared of a little immune cell, because I wanted to show some nice immune cells, because that's what I spend all my day looking at. But I don't have that, so I will stop there. Thank you very much. I know that people may have lots of questions from there. I'm going to kick around until I have to get a train, I think 10 to 5, so that my wife doesn't shoot me for missing Eurovision. But I will be around, and I'm very happy to take any questions. I'm really keen to hear feedback. If people think I've got this completely wrong, come and educate me, come teach me so we can make this better, because I think this is somewhere we can do better, and we need to do better.